Hello and welcome to this Rethinking Anatomy video. Today we're going to be exploring the TFL, or the tensor fascia lata muscle. This muscle, if you're not familiar with it, is in the hip complex, more on the anterior lateral side, and it plays a key role in walking and also in mechanics when it comes to in the gym, such as squatting and deadlifting. In today's video we're going to be exploring the anatomy of the muscle, but also giving an idea what it does functionally and its relevance to compound lifting, which again is so important when working in the gym with clients. So from an attachment site point of view, here we have the pelvis, and we have the anterior superior iliac spine here. So if you follow the crest of the pelvis round, there is a bony insertion point here, and that is one of the attachment sites, or the typical origin of the TFL. The TFL then runs laterally and goes into the IT band, so the iliotibial tract, and it runs down the side of the IT band into Gerdy's tubercle lower down on the femur. So from a pure anatomical point of view, in textbooks it typically said that this is a flexor of the hip, so it can facilitate hip flexion, it can facilitate hip abduction, so going out to the side, and in other textbooks it's also known as an internal rotator. So we have flexion, abduction, internal rotation. So this would be the motion that the TFL will be doing if it was contracting. So as you already know, if you've watched these videos before, is that it's coming away from what the textbook says and giving you an idea of when this muscle needs to be active and what happens when it's not as strong or it's inhibited, so either it's not working through its full excursion, short through long. So if we think of it like this, let's first of all take the muscle away. So let's imagine that this muscle is not going to be there. Now, the way I would want somebody to think about this muscle is, imagine you have a little spring here, so a recoil, so a spring that goes from the ASIS into the lateral aspect of the trochanter here. So you have a recoil system here, and this is going to be a hydraulic or a suspension. Now, when you're walking and you strike the floor with strike the ground with your heel, what's going to happen is that when the pelvis goes into that position, you're going to get shock absorption going upwards, obviously into the foot. Now, this is going to travel all the way up the chain, and the TFL actually acts like a shock absorber in the anterior hip compartment, which allows us to deal with the ground reaction force. It also helps place the femur, so the long bone here, in a more optimal position for the heel to strike the ground. So in other words, if we're looking at what it does from a functional point of view, it's very important for positioning of the femur and therefore positioning of the foot to strike the floor. And then what it's also going to do as well is then help the pelvis move on the opposite side. So in other words, if we have a more optimal position here, we have better stability in order to go through that full hip extension with better alignment. Now, when people have scoliotic postures, when they have hip shift, when they have all different factors going on, you obviously want to look at ways of addressing it. But the thing is, it's going to be very multifaceted. So there might be a problem with the foot, problem with the knee, and so forth. But the TFL, when it comes to pelvic torsions and SI joint irritation, is actually a very key muscle, because if one is shortened and very tight, shall we say, at the front here because it's overworking, and then one is inhibited and not working on the other side, we're obviously going to have some form of torsional pattern which is going to sustain. So what we're now going to do is we're going to go into the gym and look at exercises you can do to first lengthen the muscle if it's shortened, and then strengthen the muscle if it's inhibited and not doing its job properly. So as discussed, strength and hypertrophy differences in the TFL from one side to the other is very, very common in pelvic and lower back issues. And a really easy way that you can screen for this and see what it's like in you is if you find the ASIS, so the bony part of the pelvis, just move your hands down slightly and grip into your own thighs like this, or sorry, the front of your hip like so. And then just bend your knees from side to side, and you'll actually feel that TFL come up, and you'll be able to palpate it in your hand. You can even bring one knee up and one knee up like that, and you can look for the size of the muscle, how the tissue feels. Is one side more tender than the other? Is one side larger than the other? And so forth. And this will give you a good indication of the evenness, shall we say, from one side. Now remember, the body is unilateral in nature. It is not necessarily designed to be perfectly symmetrical. However, if you are having a complaint in the knee or lower back and there's an obvious difference, it indicates that it's something to work on. So what we want to do is train this muscle to know how to shock absorb, so how to be strong in the shortened position, but then also how to lengthen so that we can access that hip extension. So the first thing we're going to look at is going to be the actual strengthening of the muscle in a shortened position. So what I'm going to do is get a box here, and I'm going to place my foot on the box like so, with a level of abduction. So you can see my hip is abducted. You can see that it is flexed to a degree, so I have flexion and abduction. Now internal rotation would be this process, but obviously to abduct the hip and to internally rotate at the same time, you would bring in the leg out like this. And this is where we start to think, well, is that actually what that muscle does all in one? And the internal rotation qualities of the TFL is actually just decelerating external rotation as the hip is pushing off. So in other words, that's when it is decelerating. But going back to shortening this muscle, what we'd want to do is that we want ideally is to bring this knee upwards, and we need something which would bring the pelvis forwards. So what I'm going to do is I'm going to step up like so, and then I'm going to step back and rotate outwards like this. Now when I've rotated out like into this position, you can see flexion and abduction, and this is going to overemphasize a heel strike action with my foot. So in other words, my weight is through my heel, the pelvis is behind the body, and if I was walking, it would be emphasizing that motion. And the reason for the abduction and the hip flexion is to shorten that muscle even further. So what I'm going to do is stand on the box, I'm going to go down into this position, and I push through my heel and bring myself up. And what we're doing here is we're trying to emphasize driving through that heel and getting that foot contact. And the reason being is that that's going to get all the lateral muscles, so all the muscles, the TFL, the glute min and the glute med, to work throughout that range of the first initial contact with the foot. So one thing that's very important here is do not let that knee drop inwards like so. Keep the knee in alignment with the foot. We're going to open up the hip and bring ourselves upwards, open up and keep pushing through. Now when you're doing with this someone, it's very important that you get them to keep that heel contact, and what you're looking for is strength, fluidity, so how easy they find it, and also the coordination, so whether they're off balance or whether they find it challenging to do. Then what you'd simply do is just move it to the other side and see how it feels. So we're going to have the foot central, open up to that position. Is it stronger? Is it more aligned? Is it an easier thing to do? Now, the reason why we want to get all these muscles to work, so we want the TFL, glute min, glute med all to fire at the same time, is that because all of them working in conjunction together is going to stabilize the femur as we're striking the ground with our heel. And this is reflected in the neurology because they all have the similar L4, L5, S1 neurological intervention. So in other words, they're innervated by the same nerves. Once you've done this and you've got an idea of how it feels and how easy it is for the client, you're then going to move into something that tests its ability to lengthen. So this is again is just based on the anatomy which you know the muscle does, is that if it's a flexor and abductor, we want to take it into extension and internal rotation. So I'm going to slightly internally rotate my foot, and another simple way of doing this is just bringing your feet in line like so. So here I'd be working on my left TFL. Now we can see of its ability to lengthen in internal rotation, and then its ability to lengthen in external rotation. So how it controls the pelvis. We can add a little bit more of a stretch by adding an element of side bending in just to open up all the chain here. But what you're looking at is the ability for the pelvis to move in this direction and the pelvis to move in this direction. So can it lengthen in both movements? So we're going to rotate, load the pelvis and explore where it can't move, and all this anterior surface here, or all this anterior compartment, is going to be opened up. So you can push forward, you can push to the side and to the side like so, and find the restriction. Again, you do the same on the opposite side, feet in line like so, find where the hip can go. If you notice that it's easier on one side, again, that's an indication that we want to be focusing on opening up the other side in order to get the pelvis moving a little bit more dynamically. So just to summarize, we need an exercise to shorten the muscle. The TFL is like a spring and a hydraulic, where the stronger it is, it's going to help us with dealing with ground reaction forces as we have a slight flexion in the knee, slight flexion in the hip, and the heel strikes the ground. If it's weak or it's inhibited and doesn't know how to do that, we may get things such as a hyperextension of the knee. We may have things such as a shift in the pelvic position as we're walking, and it may have an impact on the other chain where there's compensation on the other side. So the strength in shortening for heel strike. If we have an inability to lengthen, so we can't fully lengthen the TFL, this may impact our ability to hip extend, which then has an effect on the glutes on the opposing side. So we want them to be able to lengthen by taking ourselves into extension, internal rotation, and exploring the range in which the TFL can't go. Now, if you do have somebody who has lower back pain or an obvious asymmetry in the hip, this is something that you can do, which is going to help them get strength in the shortened and lengthened position. Which again, what you may find is that when there's a very obvious discrepancy, simply by working on that has an effect across the entire chain and goes into other movements. Now, another area that is important to factor in is that you're not necessarily working on the TFL specifically, so it's not an isolation movement, but rather a global pattern. So they don't necessarily have to feel it directly in the TFL, but it's more just looking at, again, strength, coordination, fluidity, and how that compares from one side to the other.